continues with agenda item 2A, discussion on issue raised by the regional director. I now open the debate on the issue raised by the regional director in her address to the committee. I remind you to deliver your intervention concisely and not longer than 3 minutes. As mentioned, a traffic light system is in place. In this way, I hope we shall be able to keep to our timetable. Thank you for your cooperation. Some highest delegate wishing to speak to please raise their nameplate and keep them raised until they have been given the floor. Oh, I just received the list of speakers. So the delegate from Austria, you have the floor.
Thank you, Mr. President. I speak on behalf of the European Union and its member states, the candidate countries, the former Yugoslav Republic of Macedonia, then Montenegro, Serbia, and Albania, the country of the stabilization and association process, and potential candidate Bosnia and Herzegovina, as well as the Republic of Moldova and Georgia, aligning themselves with this statement. We thank the regional director for the comprehensive report and her continued and dedicated leadership. The EU and its member states welcome the work done by the regional office towards strengthening the health systems of its member states for a better response to the challenges towards achieving the SDGs in the European region. In this context, we are looking forward to the Astana Conference on primary health care as a big leap forward in achieving universal health coverage in line with the Alma-Ata Declaration 40 years ago. Furthermore, we welcome the Tallinn Conference of June 2018 as a milestone in promoting our joint basic values of solidarity, equity, and participation. We are pleased to note a decline in premature deaths related to non-communicable diseases in the European region. Nevertheless, evidence shows that large inequalities in premature mortality levels remain within the member states of the European region, and we are still concerned that some targets might be achieved either unevenly or even not at all. We therefore explicitly welcome the outcome statement of the CITES high-level meeting, Health System Respond to NCDs, and we are looking forward to the upcoming UN high-level meeting on NCDs in New York. The European Union and its member states welcome measures taken to accelerate the implementation of the International Health Regulation to improve public health preparedness and response in the WHO European region. Remaining concerned about recent outbreaks and health emergencies in our region, we fully subscribe to the implementation of the IHR. We commend the intensified cooperation between WHO Euro and the ECDC in highly encouraged and sustained efforts in the area of immunization and antimicrobial resistance at all levels. We appreciate the close involvement of WHO Euro in a recently started EU joint action on vaccination, and we are also looking forward to joint cooperation to decrease the burden of vaccine-preventable diseases in the region. We welcome the Regional Director's initiative of joint visits to country offices by SCRC and European EB members. This will allow the SCRC to systematically carry out its supervisory task and provide a deeper understanding of WHO's work at country level, including assessing actual needs, such as called for by the newly adopted General Program of Work. With regard to health information systems, the action plan on the increased use of evidence health information research is starting to show positive impact. Both the Health Information Initiative and the Health Information Networks of the European regions are regarded as best practice for the generation and use of interdisciplinary and cross-departmental sources of evidence, not least also for the global level. With the joint monitoring framework, the WHO Euro region will have a strong instrument to minimize the international reporting obligation of member states in WHO Euro region. This is instrumental for the timely achievement of the SDGs. And we appreciate efforts by the regional office to develop a strategy on big data in order to support evidence-informed health policy decision-making. This strategy should take into account the work initiated also by the OECD in this area. Finally, Madam Regional Director, we regret the late publication of the Program Budget 2020-21 document. We would therefore like to request additional information on the timetable and key points of the process for developing the next biannual budget, as well as reassurance that we will have documents in good time to be able to engage fully. Thank you, Mr. President.
Thank you. I now give the floor to the delegate of Russia, to be followed by delegate of Moldova. Please take floor.
Thank you very much, Chair. Regional Director, the Russian Federation appreciates the work undertaken over the last year by the European Regional Office. We would like to thank the Regional Director for her meaningful report on the achievements and challenges in the field of health in our region, and Russia would like to thank her for this greatly. For many years now, the European region has been a leader in global health care. This is largely to do with pursuing policies and actions on the basis of evidence. The analytical report on health in Europe proves that, thanks to our joint work, we have been able to make great strides forward within the region and within Russia itself. We feel that, to a greater degree, this will help the European strategies and plans for action in the field of health through the country offices and also through the geographically remote office in the field of NCDs. The WHO Remote Office has launched a series of programs and projects at a European and governmental level. The Russian Federation will continue to support the potential of WHO, not only within a regional level, but also at a global level. Dr. Giaco, we feel that evidence, knowledge, these are some of the key resources that we have that will allow us to achieve the ambitious goals in the field of sustainable development. And therefore, Russia will actively take part in the European initiative on health evidence. And we are working to improve health information exchange within the CIS region. Evidence is key for developing policies and for strengthening health systems, and therefore we are ready to share our experience with you, and we are ready to engage and work with you in this particular field. Colleagues, the Russian Federation hosted the World Cup this year, and this was a major event for supporters throughout the world, but it was also an impetus to make popular sport as a way of living a healthy lifestyle. I would like to take this opportunity to recall that we continue to welcome football supporters to our country without any visa requirements. Thank you very much.
Thank you, Mr. Chair. Madam Regional Director, Your Royal Highness Crown Princess of Denmark, Honorable Director General, Honorable Ministers, ladies and gentlemen, dear colleagues. Thank you for an excellent report on the work of WHO Office for Europe during 2016-2017, and congratulations on your success. I'm very pleased to read the Republic of Moldova has been mentioned 46 times in your report, which testifies to our excellent technical collaboration and invaluable WHO support to the government efforts and in improving population health and equity. It is with great satisfaction that I witness to the 2030 Agenda for Sustainable Development gaining momentum in the European region. Like many others, the Republic of Moldova too is committed to nationalize and further localize SDGs related to health and beyond. Leaving one behind is at the very heart of universal health coverage that we have been pursuing for years through ongoing health system reforms in the country. The review of current National Development Strategy Moldova 2020, which was not explicitly inclusive of health as a top priority, was completed last year, and following which a new Moldova 2030 strategy shall be approved soon, fully harmonized with the WHO European Strategy 2020, 13 WHO Global Program of Work, and fully embracing the SDG agenda, as well as provision from the European Union Moldova Association Agreement. Given the health and all policies and all of the government approaches, other national strategies and policies shall be duly adjusted, including the support and guidance of WHO, and I would like to thank you, Regional Director, for that support. I believe there are several key elements related to the health system strengthening to successfully advance the SDG agenda in Moldova, on which we have been continuously collaborating with the WHO, that is, strengthening the primary health care, hospital sector reform, restructuring public health services, sustainable financing, access to medicine, human resources, and health system information. Effective work across sectors is important. All of this would not be possible without the valuable support provided by WHO through policy development and strategic action planning. As mentioned before, for Moldova, achieving universal health coverage is a strategic objective ever since the National Insurance Company was established in 2001 and reforming thereafter. An important role in it has been played by the Universal Health Coverage Partnership, supported and funded by WHO, European Union, Grand Duchy of Luxembourg. We are also very grateful to Government of Japan for their ongoing support to Universal Health Coverage initiative that has been implemented in collaboration with WHO and the Republic of Moldova. WHO offers its support to harmonize Moldovan legislation of the pharmaceutical sector to IQ provision, including ongoing work on rational use and selection of drugs, reimbursement, procurement and supply system, implementation of the package of essential non-communicable disease intervention primary health settings, with work on progress on tobacco and alcohol control provisions, and follow-up on enforcement of those. We thank for WHO support to design and launch large-scale health system transformation aimed at paving the way towards universal health coverage. We are deeply grateful to Swiss Confederation and Swiss Agency for Development and Cooperation for their continued support in collaboration with WHO to health system transformation in the Republic of Moldova. Other priority areas traditionally included prevention and control of communicable diseases, primarily HIV, tuberculosis, and vaccine-preventable diseases. Moldova has been getting valuable support from WHO and Gavi Vaccine Alliance in implementing HPV vaccine in Moldova this year under a 2-year demo project. Moldova got one step closer to ensuring universal health coverage with the viral hepatitis C treatment for all in 2016-2017 by streamlining in procurement system for all commodities and full compliance with the latest WHO clinical guidelines. I would also like to thank you for the support provided in promoting the sexual and reproductive rights of Moldova, which are critical for balancing and healthy life course development. I would like to acknowledge the work that has been done under international health regulation in keeping the country's core capacities up to date, including with the support from WHO and Kingdom of Norway. Moldova is undertaking a joint external evaluation this year to further improve its preparedness and response capacities. On behalf of the country, I'd like to thank the Regional Director and your team for facilitating the deployment of 2 interagency emergency health kits to Moldova, potentially saving many lives and preventing disability, thus helping the country timely respond to health emergencies as they occur. WHO country support to Moldova played an important role in delivering high quality and tangible results at the country level, and I'd like to express full support to further strengthening WHO country offices in European region, including preparedness for emergencies. I would also like to acknowledge all support that Moldova received from geographically dispersed offices, and we greatly benefited from all five. The Republic of Moldova would like to express gratitude to member states hosting geographically dispersed offices for their generous support and contributions. Our achievements would not have been possible without the contribution of many development partners, in particular the European Union, UN country team, Swiss Confederation, Kingdom of Norway, Germany, Romania, Turkey, and without the WHO leadership in health, including through regular health sector partners, coordination council meetings, convened jointly by the Ministry of Health, Labour, Social Protection, WHO Moldova. Many more things are yet to be done in Moldova, but we stay committed to continue the health sector reforms as per the best evidence available in the region and worldwide. Thank you, Regional Director and your team, for your dedication and leadership in making all this happen. Thank you.
Thank you. I now give the floor to the delegate of Netherlands, to be followed by the delegate of Norway. Please do your best to keep the intervention to 3 minutes.
President, Your Royal Highness, Director General, and dear Regional Director, the Netherlands aligns with the statement made by our dear colleague from Austria on behalf of the European Union and its member states. There are a couple of extra remarks that I would like to make. First of all, also many thanks from the Netherlands side to you and your staff for all the meaningful work that you performed in our region. Some extra words of thanks for your work during the Amsterdam International AIDS Conference in July. We look back to a well-attended and fruitful ministerial policy dialogue for ministers from the Eastern European and Central Asian countries, spotlighting the HIV situation in the region within the European which the European WHO's office capably convened together with UNAIDS and the Dutch government back to back with the International AIDS Conference. This meeting was so important because we still have a big problem with HIV infection in our region. The high level of participation clearly showed the political commitment to invest and strengthen the AIDS response, including a stronger engagement with civil society. Continuing such meetings on a regular basis and fostering interregional collaboration can certainly support finding effective solutions to curb the epidemic. Secondly, the Netherlands aims to make firm steps to reduce the smoking prevalence tremendously the coming few years. As you know, it's an ongoing battle with the tobacco industry to protect our young generations. In the Netherlands, there's a widely held sense of outrage about the participation of the tobacco industry in national and international ISO measurement committees. In June, the Netherlands National Institute for Public Health presented their alarming research on the ISO method. It is extremely worrying that the measurements taken by using the ISO method do not provide an accurate picture of the amount of tar, nicotine, and carbon monoxide smokers actually inhale. This is mainly caused by the ventilation holes in the cigarettes. We call them cheating cigarettes. In reality, it's about the tobacco industry strategies that we have to tackle. And we call on you to take this threat seriously. Excellencies, colleagues, therefore I would like to invite all delegations to join a side event tomorrow at 8 o'clock in the Auditorium della Tecnica Sala Pininfarina. We will provide you with the latest information of this scam of the tobacco industry that is very harmful to the health of our people. There will be transportation from both the designated hotels for participants. And there's a flyer in your information pack. Thank you.
Thank you. Please.
Your Royal Highness, President, Director General, Regional Director, Excellencies and dear colleagues. Thank you, Chair. Norway would like to thank the Regional Director for her address to the committee and for her thorough account of the work of the Regional Office over the last year. Director Jacob, we remain very pleased with your leadership of the work in this region. We are in no doubt that the Regional Office is well run and that it plays a vital role in public health. We would also like to thank the Regional Office for organizing this year's conferences in Sitges and Tallinn, presenting new evidence and policy options on how we can strengthen health systems and ensure equal access to health care. We believe that the outcomes of the two meetings will support the goals of the Alma-Ata meeting and Member States' efforts to achieve universal health coverage and other sustainable development goals. Chair, we have one remark regarding the proposed programme budget, on which we would appreciate the Regional Director's clarification. We are somewhat puzzled by the proposed high-level programme budget for 2020-21. In our understanding, all WHO regional offices would receive a substantial increase in base budgets, but the European region or the European office would not. Apart from a small fraction, the entire increase in our region of roughly $25 million seems to go to the country level. Not even the compensation for inflation is kept at the regional office. To us, it then looks like the real purchasing power of the regional office would in fact be reduced. It is no more than a few years ago that the portion of the global budget going to our region was increased because it had been trailing behind compared to other regions for some time. So if our understanding is correct, we now wonder whether this proposed budget would take us back to that situation. We would very much appreciate the Regional Director's comment on this. Thank you.
Thank you. Now it's time to give the floor to Malta, to be followed by Luxembourg.
Thank you, Mr. Chairman, Director General, Regional Director, Your Royal Highness. I would like to thank you, Regional Director, for your report and congratulate you on the achievements you've made during this past year, but even more so since you took office way back in 2010. I would also like to state that Malta fully aligns itself with the statement delivered by Austria on behalf of the European Union and its member states. In line with Agenda 2030, Malta is developing a national health strategy to cover the period 2020-2030. From this national strategy, a number of thematic priorities will feed into sectoral strategies, including, for example, a comprehensive mental health plan on which work has already commenced. And we are therefore very grateful to the Regional Office for its continued support in our development of these plans. Malta is fully committed and supportive of universal healthcare, of course. Endeavouring to leave no one behind, my government has also shown commitment in improving the quality of life of marginalised groups. For example, having launched the national strategies on addressing hepatitis C, the elimination of hepatitis C, and transgender healthcare services, and the expansion of the provision of IVF services to same-sex couples and individuals. On the 40th anniversary of the ambitious and visionary declaration of Alma-Ata on health for all, Malta recognises the strengthening of primary healthcare as a priority. We are, in fact, undertaking a vast programme of innovation in our healthcare sector with the aim of doing just this. Malta supports the Regional Office's priorities for digital health. As leaders in the health sector, we need to make sure that we shape and lead the development of innovative technologies to directly benefit our patients, rather than just append or adapt technologies developed in other fields. We also believe that medical schools across the European region need to give greater importance to digital health to reflect the relevance that artificial intelligence, the Internet of Things, the blockchain, amongst others, will and already are having on the way we provide healthcare. The Small Countries Initiative has enabled the sharing of knowledge and the promotion of action, and Malta strongly favours this development. RDG, I am particularly pleased to have heard you mention the need for us as healthcare leaders to take the initiative in the pricing of medicines. Since 2017, the Valletta Group has been working to bring unity and therefore strength to negotiations with the pharmaceutical industry on new drugs. Unless we cooperate on price negotiation, price decisions will remain completely out of our hands. Malta is also pleased to note that migrant health and the serious challenges that mass migration movement bring to local healthcare services is being given importance on today's agenda. The way forward has to be solidarity. Washing our hands or turning our face away from this humanitarian challenge will, in the long run, be counterproductive. In conclusion, Mr. Chair, Malta remains committed to continue with its efforts to address the multitude of health challenges we are faced with and will continue to support WHO in its ongoing work. Thank you very much.
Thanks.
Merci, Monsieur le Président.
Thank you, President, Mr. Director General, Madam Regional Director, distinguished colleagues. We need to base our policy on clear values, and on a national and European international level, we must base ourselves on our universal values, which are based on equality and solidarity in order to have an innovative, efficient and sustainable health system in all of our countries. But of course, what must be common to all of our health policies is what also has to be the core of all of our actions. And it is these principles that we need to base ourselves on. And I believe that our meeting of this week is a very good opportunity to focus on the issues that are particularly close to our heart in this connection. And it's necessary to do more in order to promote a healthy way of living and to prevent and to do more risk prevention work. I am very much in favor of prevention, and therefore I'm very pleased to see that there are many action plans which are now being developed, bringing together many different actors. For example, the National Anti-Cancer Plan, plans against rare illnesses, hepatitis, and many more. And we are offering also vaccinations to girls between the ages of 13 and 15 against HIV. And we're also offering contraception and also vaccination against pneumonia for persons over 60 years of age. And these are things which we would like to continue to focus on. These, of course, are actions which have already led to effects in practice. Then also our anti-tobacco policy. Here we have seen that the number of smokers has gone down markedly, and it's also important to say, from my point of view, that we've had a paradigm shift in that we're now encouraging patients to make more informed choices, to have more access to information, and to act of their own will, and to have access to their own patient files, which always have to be accessible for them. I've also been focusing on work to be done in order to improve patient health with respect to surgery patients, long-term illnesses, and many things that have to do due to demographic aging. And we have been taking various aspects of progress in medical science on board in this respect. We're very pleased, ladies and gentlemen, to be able to do more and more in order to improve our citizens' health and to improve, therefore, also their daily lives. Of course, that's not enough. We have to do even more. We also have to encourage citizens to take on responsibility for their own health and to improve their health literacy, which I think is a key to success in this respect. And we must continue to do all we can in order to improve our citizens' health and their health literacy level in all of our countries. Thank you.
I now give the floor to the delegate of Lithuania, to be followed by Kazakhstan.
Your Royal Highness, Director General, President, Madam Regional Director, Honorable Ministers, distinguished delegates. Lithuania fully aligns itself with the statement made by Austria on behalf of EU and its member states. Let me extend my sincere gratitude to the Regional Director for the very detailed report and all her efforts in making European region healthier and the outstanding leadership in achieving sustainable development goals in the European region. Lithuania particularly welcomes the continued promotion of the life course approach to health to increase the effectiveness of interventions throughout life and to tackle main risk factors for NCDs: tobacco, alcohol, poor nutrition, violence, and injuries. Especially, I would like to commend the progress done in tobacco control. In this context, I would like to particularly thank Regional Director and the WHO Regional Office for Europe for the provided technical assistance during the WHO FCTC mission in Lithuania, which has evaluated Lithuanian legal acts in tobacco and related products control area and submitted recommendations for acceleration of WHO FCTC implementation in Lithuania. Furthermore, I would like to thank Regional Director and the WHO Regional Office for Europe for the support related to the activities of the forthcoming joint external evaluation of the international health regulations implementation in Lithuania to be held in November this year. The evaluation will serve an excellent opportunity to improve public health preparedness and response, as well as for the support in strengthening and maintaining the capacities for ensuring rapid detection, verification, and response to public health threats. A healthy society is a priority in the Lithuanian political agenda, and Lithuania intensively implements reforms in primary healthcare, nursing, pharmaceutical sector, public health policy actions. Therefore, I would like to particularly thank Regional Director and the Regional Office for their outstanding support on our way. The backup of the WHO with the high-quality health information and evidence enabled us to introduce very unpopular but highly needed policies to reduce harm to health. Please accept, Madam Regional Director, our deepest appreciation for that. Cooperation with the WHO as our strategic partner to ensure better health and continue reforming our healthcare system remains our top priority. We are looking forward for our continuous joint work for better health. Thank you.
Kazakhstan.
General, dear Regional Director, dear participants, by taking this opportunity, I would like to thank Madam Regional Director for her report about WHO activities within the year. Kazakhstan appreciates the work that is done by the WHO Regional Office for Europe, and we fully support the activities provided by WHO. There were many missions from WHO in Kazakhstan, and we look forward to have their productive continuations as part of the national projects. Kazakhstan has ambitious goals in healthcare development, as healthy population is a foundation of any country's prosperity. Understanding that UHC cannot be achieved without PHC, Kazakhstan, together with WHO and UNICEF, is hosting a global conference on primary health care on October 25th and 26th in the Astana. This high-level political event will be attended by heads of the states and governments, ministers of health, education, social services, head of international organizations, and many others. We want to reaffirm our belief and support in primary care and define its development in the 21st century by adopting a new PHC declaration in Astana. With great honor, I invite participants on this regional committee meeting to register for the Astana conference on PHC at WHO website and hope to see you within a month in our capital. Let me thank again WHO Regional Office for Europe for its constant support and wish to continue a fruitful collaboration. Thank you.
Thank you. Now it's time to give the floor to Italy, to be followed by Hungary.
Thank you, Mr. President, Her Highness, Regional Director, Ministers, and their colleagues. First of all, I would like to say that we fully agree with the statement made by Austria on behalf of the European Union. We would anyway to make some further consideration on the jeopardized situation on many health topics through the region and its effects, as clearly stated by the regional director, and propose some possible action lines. We welcome any effort aimed to ensure a better knowledge of health and social determinants' influence on our life. In this regard, we invite the regional director to continue in the efforts aimed to facilitate the exchange of data and the selection of indicators useful to reach a better comprehension of the phenomena and of the behaviors of our citizens, and to follow their evolution over time. On this basis, we will be able to elaborate better strategies and policies. This is one of the reasons why Italy sustains the Venice Office on Investment for Health and Development. At the same time, we invite the WHO Regional Director to strengthen efforts for improving health literacy among people and knowledge of issues and how to face them among health workers. Firstly, among the family doctors, the real gatekeeper of the health of our citizens. Thank you.
Thank you. Please, the Hungarian.
Dear Director General, Regional Director, Her Royal Highness, Chair, distinguished delegates, dear colleagues, lining with the statement made by the EU and its member states, I would also like to express my thanks to Zsuzsanna Jakab, Regional Director, for her report. The Regional Office for Europe had to respond to political and social challenges within the new global, by carrying out its activities within the new global framework of the UN 2030 Agenda for Sustainable Development. I'm happy that Hungary could contribute to these activities, and these were mentioned at several points in the report, participating in the EVIPNet, hosting the Budapest Water Summit, and of course the Regional Committee in 2017, where such new topics were raised as the big data or early childhood development. The report highlights the European region's leading role in the fight against AMR and in understanding the issue at the global level. I'm very happy to pass on to you the good news of the publication on the WHO website in 3 languages, Hungarian, Russian, and English, of the document Evidence Brief for Policy, promoting the appropriate use of antibiotics to contain antibiotic resistance in Hungary, which document was developed in cooperation with the regional office and in consultation with a wide network of Hungarian experts in various areas of communicable diseases. We were informed by the WHO that the Hungarian publication is widely used in WHO trainings on the matter. In 2018, Hungary represented itself in the high-level conferences on NCDs in Sziges and in Tallinn, celebrating the 10th anniversary of the Tallinn Charter. Both of them were very well-organized, high-relevant conferences, giving possibilities for sharing good practices among member states. In Sziges, Hungary actively participated in poster session presenting public health texts on high-fat and salty foods and sugary drinks. We strongly support that the outcomes of these conferences would feed into the UN high-level meeting on universal health coverage planned for 2019. The technical support from WHO regional and country office through the biennial collaborative agreements has played a key role in strengthening public health strategic thinking and to address priority areas in Hungary. In line with this, I would like to thank the regional office for engaging in policy dialogue with Hungary on the high priority topic of social determinants of health. Thank you very much.
Thank you. I now give the floor to the delegate of Germany, to be followed by the delegate of Georgia.
Schönen Dank, Herr Präsident.
Thank you, President, Your Majesty, Madam Regional Director, Mr. General Director, ladies and gentlemen. Germany agrees with the EU statement in its entirety. The work of the WHO in the European region over the past 2 years has been very impressive indeed, and the report indeed shows that we are at the forefront of the work being done in our area. We, in numbers, are the largest WHO region. We're also the largest donor region of the WHO. But if you look at the financial means available in our region, and Norway has already pointed this out, then you see that our region has the second least amount of financial means right after the American region, which, however, has generous donations coming from the Pan American Health Organization. So they have funds coming from there. But that should not let us forget that in our region, too, we have great health challenges that we need to rise to. First of all WHO member states have committed themselves to full and transparent implementation of the WHO health rules, and therefore it's very important for us to build up core capacities in order to make sure that cross-border health dangers can be combated. And we also need to more rapidly implement the our common WHO health rules. That's the first thing. The second thing is that communicable diseases are a problem in our region as well, so not the South Sahara, but rather multi-resistant tuberculosis and HIV are rising more quickly in our region, not down there. And it's a great worry and concern that in the first months of this reason, we had 41,000 cases of measles in our region. Also, there are more and more infections with the West Nile virus and the deaths that have been the result thereof, and therefore we must do more together and in a more targeted fashion. Then the migrant and refugees movements are a great challenge for us as well, and the WHO is playing a very important role in this connection. Madam Director, at the end of my remarks, I would like to express my great gratitude to you for the fact that you have made it possible to have a positive working atmosphere in the regional office. And the results achieved by your staff have only been possible based on this, and the Respectful Workplace initiative is something that we are very grateful to you for. Thank you very much indeed.
Thank you. Please, Georgia delegate.
Thank you very much. I would like to thank Regional Director Dr. Jacob for a very comprehensive report, and even this is impossible to identify some second priority in healthcare, but with your permission, I would like to pay attention and focus on universal health coverage. And one of biggest achievements of WHO is that even several years ago, universal health coverage has been considered as kind of luxury for rich countries only, but with new paradigm, no one left behind. We are seeing our current reality that this is, in case of political commitment, in case of strengthening with good international experience, and in case of presence of encouraged professional team, this is most cost-effective way to tackle challenges in healthcare system, literally cost-effective and not only long-term investment in country's economics. And our current experience shows that this is doable, and I'm very happy to announce that Georgia is in line with this strategy of WHO, no one left behind, and even we would be happy to share our experience that shows that within a very limited budget, it doable in case of political commitment and strengthening by international support, international technical support. Of course, challenges are persisting, and approach that we have to be very creative, we have to be very innovative in this direction. This is absolutely true, and I would like to one more time underline that Georgia is in line with this strategy, and I would like to thank WHO for this breakthrough, no one left behind, because this is not only declaration of human rights, let's say, but this is very clear way where to go and how to tackle challenges. Thank you very much.
Thank you. Now is the time to give the floor to the delegate of Slovenia, to be followed by the former Yugoslav Republic of Macedonia.
Thank you, Mr. President. Your Royal Highness, Dr. Tedros, Dr. Susanna Jakab, Slovenia aligns itself to the EU statement. We would like to thank the Regional Director for her excellent report on the work of the Regional Office in the last year. In particular, we would like to commend the Regional Office for supporting Member States in implementing what has been agreed as priorities in policy making at previous sessions and keeping the region on track to meet its Health 2020 commitments and the health-related sustainable development goals of Agenda 2030. This year, Member States were given several opportunities, mentioned before by Director General, to share good practice and demonstrate how working together within the cooperation with WHO can contribute to successes in different areas of healthcare and public health. In many of our countries, the country offices played an important role in this regard. We appreciate the launch of the new European Health Report, which is very timely in order to support our delegations at UN high-level meeting in New York next week, in emphasizing at the highest political level the importance of acting now and based on the available evidence. Large inequalities in mortality rates remain, and there is a danger that the positive trends observed in premature mortality will be reversed if the risk factors are left unchecked. In this regard, Slovenia would like to draw attention to a side event at the UN General Assembly in New York on preventing and reducing alcohol-related harm. The event is co-sponsored by several countries around the world and in cooperation with WHO and in partnership with civil society. As we have heard, alcohol is still in many ways hindering the progress in some of our countries and globally. This is an issue that does still not generate enough political commitment. The European Action Plan to reduce the harmful use of alcohol by 2020, the status report, the pricing document, the brief intervention training, and the Alcohol in Youth initiative are tools of implementation that are worth using in our region and also worth sharing globally. We hope for highest representation of all our countries at the event. Thank you.
Thank you. Delegate of Macedonia.
Thank you very much. Your Excellencies, it's working. Your Excellencies, Mr. Director General, Madam Regional Director, Honorable Ministers, distinguished delegates, ladies and gentlemen. I am Dr. Vladimir Miloshev, State Secretary, Minister of Health, Government Republic of Macedonia, and National Coordinator from Macedonia to Southeastern Europe Health Network. I have the honor to speak on behalf of the 9 member states of the Southeastern Europe Health Network who have associated themselves with the statement: Albania, Bulgaria, Bosnia and Herzegovina, the State of Israel, Republic of Moldova, Montenegro, the Republic of Macedonia, Romania, and Republic of Serbia. Thank you, Madam Regional Director, for your comprehensive and very informative regional report reflecting the World Health Organization Regional Office for Europe activities. I would like to express my sincere gratitude for your commitment and hard work, especially highlighting 2 ministerial meetings in the last year organized with the ministers of the Southeastern Europe Health Network countries, which along with the report reflection proves not only the high political visibility and commitment, but also the deep understanding of the World Health Organization Office for Europe major efforts towards development and core health contribution component. In this relation, I would like to highlight the Southeastern Europe Health Network ministerial meeting organized in February in Montenegro that recognized the immunization value in terms of health, social and economic returns, at the same time pointing out the challenges and opportunities for member states in the Southeastern Europe region. Moreover, I shall highlight the importance of the second Southeastern Europe Health Network ministerial meeting that was organized under the President of the State of Israel on the primary health care for aging population held on 10 July 2018. This conference allowed a follow-up of the previous commitments for the health system, strengthening targeting primary health care with a particular focus on the population aging phenomenon, including the challenges health systems have to face. I wish to underline the recent historical event that marks Southeastern Europe Health Network and World Health Organization bilateral partnership, the sub-regional cooperation strategy signed between Southeastern Europe Secretariat and World Health Regional Office for Europe for the period 2018-2023. This Memorandum of Understanding aims to achievement of Sustainable Development Goal 3 and to other related health SDG goals, especially its key target of universal health coverage. Furthermore, to push the goal, World Health Organization Europe poses an additional tremendous capacity, both technical and operational, throughout its regional offices, geographically dispersed offices, Southeastern Europe, a knowledge GDO, highest expertise in the field of their mandate, for example, currently being in consultation with GDO in Venice on the development of the health sector, social and economic footprint, and how investing in health support, well-being, human capital development, jobs and social cohesion. The GDOs provide evidence and knowledge for policy development and tools, as well as capacity building and technical assistance for implementation that shall be exchanged and supported. Representing Southeastern Europe Health Network, I would like to highlight their added value of as important additional regional resource and to suggest to be on an agenda item at regional committee next year. In conclusion, I would like to point out the Southeastern Europe Health Network has 17 years of successful regional alliance for health that we cherish and value mostly through our work as individual countries and together as a committed network. It is a matter of the best practices example how this Southeastern European region could mobilize itself and demonstrate maturity to commit towards the region health agenda by taking deliberate action to influence governance in other policy areas to promote and protect health through harmonizing cross-border public health and health services. All my attention were driven lately by endless committed and huge support provided by Regional Director Dr. Jacob that I would like on behalf of Southeastern Europe Health Network to thank, to express gratitude and high appreciation. Dr. Jacob's dedication to this network, that political commitment by the Minister of Health to the network has markedly improved over the years, making the network a highly efficient mechanism not only to provide sub-regional technical cooperation, but also an effective platform for strategic political discussions and decisions among the ministers of the network. I thank you for your attention.
Thank you. I now give the floor to the delegate of Turkey, to be followed by Ukraine.
Madam Royal Highness, General Director, Madam Regional Director, Excellencies, and distinguished delegates. I'm the Deputy Minister of Health of Turkey. I would like to express my gratitude to the government of Italy and the Ministry of Health for their warmest hospitality and for holding this meeting on behalf of the Ministry of Health of Turkey, our government, and our nation. I have no doubt that the productive discussions which we will have here will result in very important outcomes for the regional and global health. It's our pleasure to see that the agenda of the Regional Committee of this year is full of highly important and up-to-date issues and reflects the problems of our region. I believe the strategy documents and impact analysis reports that we will discuss here will guide us as policy makers. Ladies and gentlemen, health systems are our primary instrument for provision of equitable and effective health care for everyone. Yet this is a never-ending process in which every success brings along another target to be succeeded. And under every resilient health system, a strong primary health care lies. Achieving universal health coverage is the only possible with realization of people-centered primary health care, which is shaped with a holistic approach. With this in mind, we should consider the spendings on primary health care as investment rather than cost. Since strong primary health care is the foundation of resilient national health systems, as well as resilient health systems are the cornerstone of healthy and developed societies. For this very reason, I would like to underline the importance of this year as we celebrate 14th year of Alma-Ata Declaration and 10th year of the Tallinn Charter. With this perspective in mind, we have yielded important gains from the health transformation program of Turkey since 2002, which is built on equity, strong leadership, quality health workforce, and good governance. We have focused on quality in the next period after having solved the access and equity problem at the outset of the reform process. Distinguished participants, although financial sustainability is the primary testing tool of the resilience of health systems in the past, humanitarian crisis and emergence are the most dramatic experience in terms of testing the resilience of our health systems. We had to have the experience of testing the resilience of our health Syrians, more than 3.5 million to Turkey due to the conflict in their country. However, it's our pleasure to say that we came through this process successfully by delivering the same quality and scope of care as our own citizens. Madam Regional Director, I welcome the Regional Office efforts in order to achieve Health 2020 targets that are aligned with 2030. These works and roadmaps will guide us not only at regional level, but also at national level as well. As Turkey, we conduct all our works in this perspective. Lastly, I would like to thank Secretary once again for the priceless efforts to improve health status and equity in our region. Turkey believes persisting on current path and on empowerment of health as a humanitarian value and promotion of health will only do well for our countries, region, and the world. I thank you.
Please, Ukraine.
Director General, Regional Director, Her Royal Highness, President of our session, and dear colleagues. The radical healthcare financing reform that has started in Ukraine is now in its second year of implementation. We've started transforming the outdated Soviet system where out-of-pocket payments accounted for 52% of all payments within the system, and as the regional director's statistics showed 640,000 households annually faced financial disaster due to catastrophic medical expenses. We've introduced a new primary health care model where patients can freely choose their own family doctors, and primary health care providers are paid for their services under a per capita payment system by the newly established National Health Service of Ukraine. The number of visits of family doctors is not limited, and the primary health care providers have become gatekeepers into the system. The list of primary care services provided to the patients free of charge includes treating common diseases and conditions, providing preventive medical examinations for at-risk groups, administering standard medical tests and proper analysis, and issuing prescriptions for medicines, including painkillers for those who need palliative care. The guaranteed benefit package covers up to 80% of all patients' health care needs. Madam Regional Director, I'd like to inform you that since April of 2018, more than 17.5 million Ukrainians have chosen their family practice doctors, making this campaign the fastest known to date. About half of Ukrainians have their healthcare facilities already joining the reform, and other providers will switch to operating under the new system by the end of this year. The National Prescription Medicine Cost Reimbursement Program has been working for a year and a half, and over 18% of the population is using it, receiving medications either for free or with a small copay. In 2020, the reform will be implemented in the specialized care sector. We're facing new challenges related to a large-scale reorganization of the National Hospital Network, and we hope to have the support of the WHO in helping us so that those that are overextended will be able to continue their professional development and retraining of the staff. Having the second highest number of HIV cases in Eastern Europe and Central Asia, we're making the national progress toward the 90-90-90 targets to stop the HIV/AIDS epidemic in Ukraine. Screening for HIV is now provided in all primary health care facilities nationwide at no cost to the patient. By the end of 2020, all patients in the queue for HCV treatment will be provided with highly effective medicines. We've achieved this progress through an effective cooperation with medicine manufacturers and a significant reduction of procurement prices to a tolerable level for Ukraine. Vaccines are procured by specialized international organizations in accordance with a modern strategic three-year planning system, and we plan to increase our vaccination coverage rate by the end of this year. Madam Regional Director, the elimination of corrupt practices in healthcare and the introduction of effective modern approaches to public health can constitute the key to enhancing safety and security in Ukraine. All of these achievements have been done despite the war that's happening in eastern Ukraine and the illegal annexation of Crimea, and I'd like to thank you personally for your support for the humanitarian effort that has been necessary in Ukraine. Thank you.
Thank you. And now give the floor to the delegate of Andorra, to be followed by the delegate of Denmark.
Thank you, Mr. President. Excellencies, dear colleagues, ladies and gentlemen, I wish to read a statement on behalf of all small countries' health information network, SHIN. Small countries have a lot of things in common, such as small territories and populations, small administrative structures, and health information systems, usually poor in resources, but like bigger countries have to keep up with the demands from international organizations. In the Small Country Initiative, RC68, all 8 countries make up a very diverse network in the European region in geographical and population size terms. The Small Countries Health Information Network, SHIN, was created by SCI in 2016 under the umbrella of the WHO European Health Information Initiative in order to solve common problems on collecting, processing, and disseminating small country health data, speak with a common voice in front of international organizations and other countries in international meetings. The first results arising from SHIN National Focal Points meeting have been to create rolling average methodologies across WHO, Europe, establish a gatekeeper function to limit the reporting burden, and produce a sustainable and comprehensive core set of health indicators of interest, especially to small countries. In the recent high-level meeting held in Tallinn, Estonia, we agreed to follow the 3I: include, invest, innovate in health. After the last meeting of SHIN held in Reykjavik, Iceland, we propose information as the essential fourth I. In the SHIN opinion, information has to be the first I. Information should indeed be the precondition for any decision and action plan in health and health systems. For our health system sustain, we must be well informed about the health problems affecting the population, the resources we spend to tackle them, as well as their effectiveness. Health information systems in small countries are usually versatile enough to generate information with the last time lag. The experience of small countries in the area of health information creates a useful laboratory for piloting innovation in health systems, not only for us, but also for all countries in the European region and beyond. We, the Small Countries Health Information Network, would therefore like to offer our collaboration for teamwork to all countries for a better health for all in Europe, request your support and help to keep the SHIN network alive for the benefit of all of you, big and small countries. Thank you very much for your attention.
Thank you. Please, the delegate of Denmark.
Thank you, Mr. President, Your Royal Highness, Director General Dr. Tedros, Madam Regional Director. Denmark aligns itself with the statement made by Austria on behalf of the EU and its member states. During Denmark's first year as member of the Standing Committee of the Regional Committee, I have experienced at first hand the great ambition and the strong leadership of our Regional Director. And I would like to echo colleagues in thanking you, dear Susanna, for your dedicated leadership, while at the same time also acknowledging the strong work of you and your team at the regional office. Implementing relevant policies to achieve the Sustainable Development Goals and the triple billion targets of the 13th General Program of Work will be a huge task. We look forward to a fruitful discussion on the regional implementation of the GPW 13. In this regard, we welcome the focus on strengthening of health systems, and we fully support the outcome documents of the two excellent conferences held in Sitges and in Tallinn. Also, we look forward to the Astana Global Conference on Primary Healthcare, as we believe the development of a strong primary healthcare sector to be crucial in the achievement of universal health coverage. Just a few weeks ago, in August, in Copenhagen, Denmark was very honored to host the first meeting of the WHO Task Force on the economic case for primary healthcare. This task force brings together experts from academia, international organizations, and member states to build an economic case for primary healthcare to be followed by a report in preparation for next year's World Health Assembly, as well as the high-level meeting on universal health coverage next year. We are very excited to be part of this task force, and I want to express our gratitude to the WHO for initiating this important work, while at the same time promising the full support of Denmark in this endeavor. We are confident that the outcome of the Astana Global Conference on Primary Healthcare would be a significant input towards the UN high-level meeting on UHC next year. To achieve the 2030 agenda, we also need to ensure effective monitoring of results. Denmark explicitly welcomes the joint monitoring framework as a solid instrument in this regard. Finally, Denmark welcomes the strategy for men's health. This strategy highlights the importance of a gender-responsive approach in the achievement of health for all. We would like to congratulate the regional office on the excellent work done on this important matter. Thank you very much, Mr. President.
Thank you. And now I give the floor to Sweden and then to the delegate of Cyprus. And I would like to tell you that after that we should have the lunch, and then we'll resume the discussion after lunch, after the General Director's speech. Please, the Sweden delegate.
Thank you, Chair. Regional Director, Director General, Your Royal Highness, Excellencies and colleagues. Sweden aligns itself with a statement made by EU and its member states. We would also like to echo the other member states in thanking the Regional Director for her dedicated work and committed leadership on realizing the WHO European vision for a better, more equitable health and well-being for all, at all ages. The comprehensive report of the work by the Regional Office is an impressive showcase on work done and efforts made on various health challenges in the region, but also a striking example on how health is at the center of our development. Sweden would especially like to express our gratitude for the inclusiveness and transparency towards member states in the process of our joint efforts, working together towards our common goal to improve the health and well-being in our region. We would like to commend the work to align the Health 2020 framework with the Sustainable Development Goals and efforts made towards achieving the Sustainable Development Goals in the European region. In this respect, we would also like to point out the importance of the European Strategy on Women's Health and Well-being, as well as this year's reports and strategy on men's health and well-being, linking gender, human rights, and health determinants. We also welcome the unified approach on health emergencies and health threats and the reform of the WHO's work in outbreaks and emergencies, as well as the work on accelerating the implementation of the international health regulations. We would also like to thank, of course, the Regional Office for its continued leadership in combating the global public health threat of antimicrobial resistance, AMR. We welcome the region's continued work to promote a life course approach tackling NCDs, with a firm focus on leaving no one behind. This approach stresses the need for strengthening governance for health, addressing all determinants, investing in disease prevention and health promotion, as well as engaging communities strengthening health and well-being, while also strengthening health systems and primary health care to achieve universal health coverage. Thank you for your commitment and your continued support.
Thank you. Cyprus delegate, you have the floor.
Thank you. Thank you, Chair, Your Royal Highness, Director General, Madam Regional Director. The Republic of Cyprus would like to congratulate the Regional Director for the most comprehensive report, as well as the huge work accomplished under her leadership, aiming to secure the highest standards of health as a fundamental right, continuing to improve health in the region. Not undermining other initiatives because of the limited time available, please allow me to make reference only to two areas, reserving the right to discuss other areas during the sessions to come. Health 2020 policy framework managed over the previous years to maximize opportunities for promoting population health and well-being, reducing health inequalities and strengthening public health through an equitable, sustainable, and of high quality people-centered health system. Europe and, of course, Cyprus respond to current political and social challenges while carrying out their activities within the new global framework of the United Nations 2030 Agenda for Sustainable Development. Cyprus recognizes health as a prerequisite for socioeconomic stability and sustainable development. Various ongoing initiatives promote sustainable development, examples being global education, an interministerial, interagency, and multi-stakeholder coordination and cooperation, and the National Strategy for Adoption to Climate Change that implements Paris Agreement on climate change. The voluntary national review for Cyprus led to the conclusion that a large part of the 2030 agenda is accomplished through already implemented national and EU policies. A highlight is a success in achieving 100% in a number of SDG 3 targets, some of them being the maternal mortality ratio, the proportion of deaths attended by skilled health personnel, under 5 mortality rate, and neonatal mortality ratio. In 2016-2017, WHO Regional Office for Europe implemented its commitment to help countries strengthen their health systems and public health capacity. Health systems are at the core of policies seeking to combine better use of resources and greater response to rising needs of patients. Enhancing public health capacity can become the spike on the arrow against the challenges health systems face. A policy dialogue on health systems and public health reform took place in Cyprus in September 2017. During this conference, there were constructive discussions on the prospects and challenges that public health faces in the country based on the findings of EPHO, a tool developed by WHO and applied locally. The results are expected to be the springboard for coordinated actions, and the initiatives already applied in the area are expected to deliver health outcomes in an equitable and sustainable manner. The regional director, as well as the Minister of Health of Greece, participated actively in the process. I'm confident that for the years to come, European Office will pursue its vision for better health for Europe through its cooperation as an administratively efficient, technically excellent, innovative, flexible, and inspirational organization. Thank you for your attention.
Thank you. We shall now break for lunch and return to this room at 2:30 p.m.